The primary focus of this video is to discuss the functionality of the abdominal, iliacus, and psoas muscles, as well as the exercise routines that corresponds with them. Before starting any exercise routine, it's very important to stretch. Stretching keeps the muscles flexible, strong, and healthy. And we need that flexibility to maintain a range of motion in the joints. Without it, the muscles will shorten and become tight. Then when you call on the muscles for the activity, they are weak and unable to extend all the way. Plus, it puts you at a risk for joint pain, strains, and as well as muscle damage. In addition to stretching, it's also very important to perform proper warm-ups before any types of physical activity. Warming up has proven to minimize the risk of injury, and it also increases the body's core temperature as well as the muscle temperature. The iliacus is a part of the hip rotator muscle, which is one of the key muscles in maintaining proper body posture. The origin of the iliacus is at the iliac fossa within the abdomen. The iliacus is responsible for flexing thigh on the hip pelvis and for forward pelvic rotation. The psoas major is responsible for flexion and lateral rotation of the thigh and the hip, as well as flexing the trunk and the hip and trunk laterally. These next few exercise routines will mainly focus on the rectus abdominis as well as the transversus abdominis muscles. Using a machine is a good way to add resistance to target a specific muscle group. The abdominal crunch machine targets the rectus abdominis, transversus abdominis, as well as the external obliques. Using a stability ball promotes proximal stability and balance. The stability ball crunch adds difficulty to the traditional crunch and primarily works on the rectus abdominis and transversus abdominis. The rectus abdominis has two heads at the origin, one at the anterior inferior iliac spine and the other on the ilium and above the acetabulum. Sit-ups are performed by lifting the trunk from a horizontal to a lateral position. It works on the rectus abdominis, transversus abdominis, obliques, and as well as the hip flexors. During a sit-up, the transversus abdominis will maintain the abdominal organs as the torso bends and rotates, while the rectus abdominis will pull the rib cage and the pelvic bone toward the middle of the abdomen. The plank is an isometric exercise that promotes muscular endurance. Many muscles are worked during this exercise, including the rectus abdominis, transversus abdominis, and as well as the obliques. The external and internal obliques have an origin that extends to the outer part of the ribs. The insertion of the obliques is the pubis, iliac crest, and linea alba. The internal oblique muscles bilaterally flex the trunk and rotates the body side to side. The external oblique muscles pulls the chest downwards and compresses the chest cavity. Another exercise routine that you can do to focus on your obliques is called the Russian twists. This exercise can either be performed with body weight or with a medicine ball. It's a good exercise that primarily targets both the internal and the external obliques.